Dr. Steven Schleicher brings 3 decades of experience in the field of dermatology, and he is our guest on the show today. He wrote a 4th edition, I think, to the book now, isn't it? Of Skin Sense.
Number 4.
Number 4. And he joins us now. Well, we're definitely going to argue about something, right? That's what we like to do.
Well, last time I was here, we argued about water. So, I mean, how that happened, I don't know. But we were talking about the benefits of drinking water on your skin.
Yeah.
I mean, it's great to drink a lot of water, but it doesn't do an awful lot
What kind of water?
on your skin. Well, I mean, water's water.
So purified water, spring water, tap water.
Do you want to drink the water from the vase?
It's not going to matter too much what water you drink.
Should we make you drink out of the vase?
But the key thing is to drink fluids, okay? And, before I forget, I like your cups. Pink really matches my personality.
It does.
Certainly
that's
does.
perfect. That's great. You guys are so considerate.
It certainly does. You're always in the pink. So with this being the 4th book, you literally wrote the book on skincare. You have been seeing so many changes.
Well, that's true.
Career.
And actually, just last weekend, I was in Washington, D.C. I addressed the American Podiatric Medical Association. And my topic was what's new in dermatology.
How about it?
So pretty timely. And people would be amazed what's new in dermatology. The last edition of my book was 2017. So, which means I submitted it for publication in 2016, so we have 7 years, and we have probably like 50, 60 new drugs just in the field of dermatology.
Now I'm going to give you a compliment.
Amazing.
Are you ready?
I don't know
First
if
and only.
Yeah.
We've
Wait,
been
am
doing,
I the referee?
You've always been kind of sarcastic, so I'm kind of worried.
Our Skin Sense show for over 20 years, so this will be his first compliment. Dr. Schleicher has been so advanced in medicine. He's done telemedicine way before COVID happened, way before Zoom happened. So I'm telling you, when it comes to advanced technology in medicine, people weren't even, I remember going to your first office and you were meeting with people doing telemedicine. And now it's almost really the way of the world.
It is pretty amazing because I did my first telemedicine, I think, in 1999.
Right.
Wow. So, and other derms would say, Schleicher, what are you doing? You know, that's never going to work. And then COVID came, and then there was no alternative.
So if you want credentials on someone writing a book, he doesn't know much, but he does know about skin. We'll give him in dermatology. He knows everything about the skin.
I mean, I don't know about life though, so I'll need some education. Manners, I don't know that, but that's okay.
I remember having a mark on my skin on my leg, and I took a picture of it because we're so close that I could send you a picture like that at night. But I saw this thing and I thought, oh my gosh, my dog was looking at it, and I'm thinking, that has to be something, because dogs sometimes have that sense, and it was just never going away. So you texted me, I want to see you first thing in the morning. And it was a pre-skin cancer.
Yeah.
It was just amazing that
it's amazing.
And you can see.
And you say we're so close, but I can get images from Europe, from Asia, wherever. And that's what's so cool about technology. Okay, and you can save lives, because some of the skin cancers are deadly, and if you catch them early, it will be life-saving.
Well, you have to have the genius brain that you have to be able to detect it in the first place, because a lot of things are just passed over.
What are you seeing when you say there's so much latest in technology with derm? Talk about some of those.
Well, you're seeing things like when we talk about moles, okay, there's something called, real simple technology, but there's something called the dermatoscope, which is almost like a magnifying lens, but you can kind of see under the skin. Mm-hmm. And it's maybe $800, $1,000 for it. Virtually every dermatologist has it. Mm-hmm. But we can take a mole and better define whether that mole is totally benign, whether it may have some malignant tendency, or whether it really is malignant. And that's a real simple one. Okay, and then we have, there's refinements of techniques. I know Christine Cabell has been on your show. She's, in her office, and Mohs surgery is where you can actually cut out a skin cancer and then look at the edges to see if you've gotten it all.
Right there in the office.
Right there in the office. So we're not talking about anything that's, $500,000, $1 million. When you're talking about X-ray equipment, yeah, you're talking, that amount. But in dermatology, everything is kind of simple, and which makes it good because it's affordable.
How about the treatments? How have the treatments
Well,
gone?
the treatment is amazing. They're not affordable. That's the problem, okay? So in this country, we have a problem with expensive medications. Some of the medicines for psoriasis can cost $60,000 a year, $90,000 a year. One injection of a medicine might cost $11,000 for one syringe. So how do we get people access to the medicines? That's a major thing that's going on in this country.
My friend has eczema, and I'm telling you, she has patches on her elbows. And I said, "What is this?" She said, "Eczema." I said, "Well, get it treated." She said, "Do you want to pay $20,000 for the medication?"
Yeah, well, that's about what it costs. Okay, but the medicines are marvelous. I mean, it's the first time in really 2017 we had a revolution. It's called Dupixent. And that was the first, it's called a biologic, but it's the first medicine used to basically control eczema that's not really a steroid. We give steroid shots very frequently for eczema because they're very inexpensive and they work. But you don't want to keep getting steroid shots, okay? This drug is marvelous. The incidence of side effects are very, very low. And the cool thing is it's so safe, it's approved for 6 months and above. Infants can use it for bad eczema. Yeah.
Age 6 months. So why doesn't the government pick this up if it's a condition? Do they think it's cosmetic?
money.
Do they think it's cosmetic
not
or
so
what?
much-
But I mean, it's very, very annoying to the person.
Yeah, right. It's not so much the government. We're talking, run-of-the-mill Americans have health insurance, not from the government, from the Blue
Right.
Crosses, the Aetnas, the U.S. Healthcares, or whatever, the world. And sometimes there's a problem with them covering it because they are expensive. And sooner or later, these dollars are going to have to be borne by somebody. And right now there's a big thing going on politically about what to do with healthcare. How do we get more people access to medicines? It's huge.
Wait
It's
a minute.
really
So
huge.
you're telling me a shot could cost $11,000 or
shot.
whatever? A shot.
Yeah.
So
Well, you get the
what
shot
is
every
the actual
3
cost to the drug company? Come on. It
That's
can't
a
cost them
closely.
$11,000.
Well, see, in this country we have barriers because the drug company can't get it to the patient without going through
Okay.
another entity. Okay, and then you get these price increases. And of course you have to say that to develop a new drug, it costs tens of millions of dollars. It's not cheap. So, those are expenses that the drug company has to bear before they even bring a drug to market.
So basically there's a cure for everything if you can afford it.
We're going to take a break. We are talking with Dr. Stephen Schleicher. He's on his 4th edition of the book, Skin Sense. We'll tell you how you can get the book, how it can help save your life too. There's talk about here and do's and don'ts for your complexion, the role of nutritional supplements, social media, proceed with caution. I want to get to that when we come back. You're watching The Girls here on SSP TV. You need the book. It's called Skin Sense. It's the 4th edition. We are with Dr. Stephen Schleicher here on The Girls, and we're talking about the updates in technology with dermatology. Before the break, I said we would talk about the social media. Proceed with caution. There is an overwhelming amount of information on social media.
Yeah, it's funny you mentioned technology, cheap technology, where every kid in the world is on their iPhones or whatever. And the good thing is, obviously you can get information like immediately, all right? And most of the information on social media sites is good. I mean, some's actually put on there by physicians, doctors, and whatever. But you get a percentage, maybe 10% or 15%, that is so bogus. And the problem is that people they don't know, and they're following this bogus information. And they're messing up their heads, they're messing up their bodies, and everybody with dermatology, of course, everybody wants to look their best. So where do you turn to? Well, you turn to the TikToks of the world, the Facebooks of the world, wherever, the X's of the world, and that's where you see these gorgeous women or gorgeous guys, and everybody wants to be like them. And how do they get that way? Well, they'll put out these sometimes totally bogus tips. And a lot of times it's because they're selling things. And I just urge people to be really, really, really careful because, you know, the internet is just filled with, you know, really good stuff, but some really, really bad stuff.
I saw one on one of the reels that was a microneedling, the at-home version of it.
Oh, gosh.
And it was a roller with all these pins in, and I'm just like, why would you want to stick all these pins in your face?
Well, because they think they're going to look better.
No, it's just
I know,
these
but
home treatments are crazy.
That's one of the less harmful things you can do, believe it or not. I mean, the good things are the needles don't go in that deep for these micro needles.
But they've made their
But
own.
you can, well, if you make your own, that's not a good
That's
thing.
what I'm talking about.
Yeah, that's not
It's
a
not
real
even
good
sterile.
thing. No,
When
no.
you talk about all these products that are out there, and it is like we're in a world where, of course, people want to look youthful, they want to look younger. So what are some tips you could give people aside from, you know, all these products that are out there? Should they go and buy their skincare from a dermatologist? Is that like the safest
No, it's not
way?
necessarily true. No, I think, you know, kind of the less you do, the better. When you're talking about procedures, I just think people go too far. You know, when you're talking about lips, when you're talking about, you know, the Botox, the neurotoxins of the world, I mean, you could tell that, but some people want to look phony.
Right.
You know, it's like they're happy looking that way. I mean, personally, I try to discourage patients to get lips that are, you know, 10 times bigger than what, you know, they usually are. But some people want other people to know that they've had these procedures.
Right.
To me, I mean, why not be as you get the procedures and look really natural,
Right.
which is great. You know, that to me is what procedures should do.
Well, that's another thing
But-
with picking who you go to for the procedures. You want to have those conversations of what products they're using and
Right.
like you're saying, some people want to walk out there looking like they've had their cheeks done, looking like they've had their lips and their faces are, you know, back. And other people just want to look like they looked 10 years ago, meaning just bring my
Press
face.
the refresh button.
Right.
Yeah.
Bring my face back where it was. Or
I mean, we're getting guys now who want their brows like up to here. I guess they want people to know they had Botox. It's kind of, to me, it's kind of weird, but whatever, you know. And then when you talk about products, which are good products, well, I mean, there's still a lot of hype out there, you know. And generally, we recommend either something called a retinoid, which is like Retin A, which is, you know, some of the forms like Renova, they're FDA approved to help prevent wrinkles in conjunction with sun avoidance. So that would be good, okay, to use. But the problem is there's other products out there that either don't do any good or probably do harm. And so we always advise patients, you know, the fewer amount of things you put on your face in general, the better.
SPF, SPF, SPF. Wear sunscreen all the time.
Well, you don't have to.
Right?
It really depends on your type of skin. Okay, if you are fair skin, yes, like you have to wear an SPF of at least 30, and preferably 50.
I mean, I know I have SPF in my makeup, but I try to wear it now that I'm in so much sun
Florida.
that I really like cover my hands and my ears and my neck, the parts of my body that I know are going to at least be exposed through the windshield of,
Yeah,
of
and
the car.
the sun depends. You know, strength depends on where you are, and like you said, the sun in Florida is a lot stronger than the sun that's up here in
And you get more
Pennsylvania.
sun.
Well, and you get more sun because here it's rainy every other day. I mean, it's like really been pretty incredible.
So you're safe from the sun.
I'm the prime
Well, it's one way of looking at it, but yeah.
Yeah, I'm a prime example of being raised without the SPF, and in my generation,
Nobody
we put
knew.
baby oil on and went outside and baked it in the sun. I didn't do that because I was fair complected, but I always had burns. And so the skin cancer we found on me, on my legs, was typical of my having a sunburn when we'd go on vacation. Even if I wasn't in the sun, just walking from the hotel
She
rooms,
always had
whatever.
bad
I had
sunburn.
bad sunburn everywhere.
No, and I mean, back in the day, people used reflectors. You know, you'd see them out there with the big reflectors.
How about the
Those-
tanning beds?
Tanning beds are really bad. Okay,
How are
they're
tanning beds still around?
They're really bad. Okay, you don't want to go to tanning beds. It increases your risk of skin cancer every time you go in a tanning bed.
Let's take a break. And when we come back, we're talking with Dr. Schleicher. The book is Skin Sense. It's the 4th edition. We'll tell you how you can get the book, how it can help you. There's some really good tips in here And also, I want to talk about spray tanning too. Is it good? Is it bad? Is it not? You're watching The Girls here on SSP TV. We'll be right back.
Welcome back with Dr. Schleicher. He is a dermatologist since, what did you say, 1891?
Quite some time. Yeah, quite some time. So.
You'd never know by how you look. But we have your 4th edition of your book, Skin Sense, here, and the topics that are in here are incredible, because one of them I wanted to ask you about is spray tanning. We left before talking about tanning beds, how bad they are, but then you replace that with a spray tan. Now, what's in the spray tan? The chemicals?
Well,
bad?
yeah, it's actually a chemical that coats the top layer of skin. Okay. And it's a harmless chemical, okay? So that's not the problem. The issue is you don't want to breathe in spray tan. You don't want kids getting spray tanned, okay? And the other issue is people just don't realize that spray tanning doesn't have any SPF to it. So you're not being protected from the sun.
Oh, in other words, when you get that spray tan, don't think that you have a base tan and you can go outside without anything on.
Right, right. And a lot of people are kind of confused with that and think it protects them and then they can go out in the sun longer. Well, you can't. So
it's just like self-tanner, but sprayed on you.
Yeah, and it lasts about anywhere from 7 days, 14 days. And like I said, it's a harmless dye that gradually wears off. But the cool thing about it, they do look good.
Yes.
And they look natural.
They do look natural.
And, in the beginning when these self-tanners came out, people looked like pumpkins. They were so bad that you could tell immediately that a person, looked like someone's hair, but I won't go into that part. But anyway, the orange hair, we won't go into that. But that's what they look like. But now they're great. You can't tell.
As long as you don't breathe it in.
Yeah, you don't want to breathe it in.
So hold your breath while you're getting it.
Yeah, you want to wear a mask. If you can't wear a mask, yeah.
So how about people at home, just to switch gears a little bit, on the safety of taking care of your skin, knowing like what's on the back of your ears, on your back, underneath, between your toes, like moles. And we've had so many conversations about this. Yeah. And most of the time, your hairdresser could point out some things too.
You raise an awesome point, because how are you going to see a mole on the back of your, and if you don't have a partner, who's going to look at it?
You are.
Well, you are, but how are you going to do it? Yes, we advise.
You are.
Well, I am.
You have to come, don't you make an appointment and come in to get a skin check?
Right, but a lot of people, if they knew they had something on their back of their head, they would make an appointment immediately. How are you going to know? But like you said, we try to get to hairdressers and we try to educate them, because they actually refer, patients to us because they see things that patients just don't see.
How dangerous are those lumps that people get in their head? Are they?
Well, no, most lumps are not dangerous at all. All they are is cysts. They're they don't look
like
good.
Like a block pore.
But they're like a block pore. They're nothing. But you can get skin cancers, in the head, and that's bad. And you mentioned the nails, okay? Especially in African Americans, that's one of the most common sites to get the most deadly form of skin cancer, which is melanoma. Bob Marley died of a melanoma, of neglected melanoma of his big toe. But people don't know. They don't realize.
And don't wait. And don't say, oh, I'll get it checked later. Get it checked early. Detection is the key.
Yeah, and both of you know. Going to a dermatologist, it's pretty easy. Right. You know what I mean? It's really, really easy. So, we can look at a thing and by and large determine 95% of the time whether it's something that has to be analyzed or not. And if there's any doubt whether it has to be, of course, we'll take it off and get it analyzed.
Exactly. I had that done many times with my skin. Just a little punch on the leg, and then you have a little sore where you wear a Band-Aid. Yeah, and then there's the creams.
And you bring up a really good point, too, because of all the places on the body, the leg is the slowest healing, which okay? You encountered that because the circulation just isn't as good on our legs as we get older. So you have to be a little bit careful about treating things on the lower leg.
With your book, Doc, this is also good for not just older adults, but for teens. Let's talk about acne and some skin conditions, maybe with people playing sports. So this is a good read for parents or for teens on taking care of their skin when they,
and it's funny,
during adolescence.
You mentioned sports because we see wrestlers all the time.
Yeah.
And if I had a kid, I don't know if I'd want him to wrestle, because you can get things from fungal infections to viral infections to, we talk about viruses, we're talking about herpes, and like because you're in proximity to something called MRSA, which is a staph infection. We see it all the time. And a lot of times when they wrestle, they cover them up, but then the bandage will come up or whatever. We worry about that. So, but that's one of the things we talk about in the sports chapter.
How about golfers out in the sun all the time? What should they be doing?
If you're out in the sun, but the other thing we worry about too with golfers, they're going in the rough and they're coming out with ticks.
Right.
Okay, so we see a fair amount of Lyme disease, and Lyme disease can be kind of serious. So
I'm only laughing and smiling because I remember when my son was little and we had just done a show, and my son he was playing outside a lot. It was tick season. So I found this, was it on his head? I don't know. It was on his head or his back or something.
Yeah.
And I threw a fit because I thought it was a tick. So I was like squeezing it. And Doc's like, just come over and let me see it the next day, because he was playing tennis. He goes, that's a mole. Leave it alone. After this kid, I must have
you squeezed it so much you mutilated the poor kid. We had a reporter. Yeah, it was pretty nasty.
Like, Mom, you're squeezing I was so convinced it was a tick.
Yeah, well, it's so funny because about 6 months ago, I had a patient, his wife brought him in for a mole on his belly button. Okay. Oh. It's actually a well-known person in this area. And it wasn't a mole, it was a tick. And it was a big tick.
Oh.
Yeah.
How long
they start
it was there like 2 days.
Oh, God.
Yeah. And they thought it was kind of cute. My husband has this mole on his belly button. And I took one look. Oh, sorry, that's not a mole, that's a tick.
How do you get it out?
Well, the way to remove a tick is you want to take a real fine forceps, and you want to make sure you get the head. So you want to go really close and make sure the head's out. But they sell these little tick removal plastic things, which are great on Amazon. They're real cheap, and you just put it like kind of around the tick and pull up, and it pulls the whole thing out.
And
they're great.
You're supposed to keep the tick, right, and bring it?
Well,
or do you have to get it tested?
if you're really concerned about it, you can send it out to a testing lab, and they can tell you whether it has the Lyme organism in it. So, but we see we see Lyme disease.
We did that with our dog. He had the little mark on him, and I think, is this a mole or not? And the breed is known for them. So anyhow, I figured out it was a tick. So I got the tweezers. I went down, put it in a plastic bag, and then I sort of like pressed on it to make sure I got all the legs and everything. And then we sent it to the tick control thing, which is free, and they came back and told us exactly what was wrong, because it was treated with antibiotics for 2 weeks.
Yeah.
But it was, it's quite an ugly thing.
So how do we get the book? Where's the book?
Well, right now it's on barnesandnobles.com.
Okay.
Should be on Amazon, but on Amazon they have one of the older versions too, so make sure it's this version. Has my newest picture on it.
I mean,
okay? So yeah, you don't want to get
fun of the picture.
Yeah, it has more gray hair in this version, so that's how you can tell. But
I don't even have to pick on him. He does it for me.
Well, yeah. I try to anticipate what you're going to say.
I got it.
So yeah, it hurts more when it comes from you.
There you go. Well, the book is called Skin Sense. Again, if you are following along on SSP TV, we've had a show called Skin Sense with Dr. Schleicher. I feel forever. It was 25 plus years.
Yeah, it's been a long time.
There's good shows on there if you want information on your skin, and also the book, again, barnesandnoble.com.
Yep.
All right.
Yep.
Doc, it's been nice.
Super. It's been a pleasure.
It's been nice. My mom's been the
well, it's
the
great.
referee.
I see you guys either here or in the office, so
There you go.
it's great.
All right. Well, on that note, we'll see you next time on The Girls.